introduce yourself?
My name is Dr. Nwobashi, Lilian and Ndidiamaka. I'm a pediatrician working with Alex Ekweme Federal University Hospital, Abakaliki, AEFUTHA. I'm also the president, the Medical Women Association of Nigeria, the Ebonyi State Chapter.
What does M1 stand for and what inspired its formation?
M1 stands for the Medical Women Association of Nigeria. It was formed as a group to look out for the welfare of our members. Our mission is to be a foremost medical association. We want to be at the forefront in the pursuit of improved healthcare, especially as it pertains to women and children.
What are the core goals of M1 and how are they being achieved right now?
Our goal as M1 is to improve the health of the populace. We're not being partial, but like I said, more of women and children. So for us to achieve this improved health indices, we do a lot. One of the things we do is health awareness creation. We know that people work more with the information available to them. If someone doesn't know the road to Lagos and you just say get up, go to Lagos, they might end up in River State. Apart from the health awareness, we do a lot of collaborations. We also work with the policymakers. The policymakers here I refer to are the government and big time NGOs. If you teach a woman that when you're pregnant you need to go to hospital, and then she comes out the day she's in labor and the bridge or the road to their street is cut off, she may not be able to get to hospital. So we also work with these policymakers. We approach them, we talk to them, we convince them to do some things for this people. We also work with like-minded NGOs. It's not just us that want to improve the health of women and children. There are NGOs, there are organizations, there are bodies, all these people that have like-minded goals with us. We collaborate, we work hand in hand, all aimed towards improving the health of women and children.
Can you share some key health initiatives that M1 has carried out recently?
We work with the elderly, we work with the people living with disability, we work with girls, we work with schools, that's teenagers, adolescents, we work with men. We've done a lot with women. At the beginning of our tenure in October, when we started our breast cancer awareness initiative, we were telling women what they need to look out for. We were teaching women how to examine their breast because it's very important. You're not just owning the breast, you must know how to examine, when to examine, and what you will see, and you raise alarm. In the past, we used to have cases where women 50, late 40s, 60s coming down with breast cancer. But in recent times, the surgeons amongst us told us that younger girls are coming down with lumps, some of them cancerous, some of them not. So if the younger population are coming down with it, we were no longer focusing on just the women, we had to go down to the girls. So we went into the university community, we collaborated with their student union government, we gathered them, taught the girls how to examine their breasts, and we were able to examine some of the girls that were willing, and we picked some lumps, we referred them back to the hospital, and then the surgeons. We also worked on cervical cancer. Notice a lot of it happening here in Ebonyi State. And what is scary or worrisome is the case of late presentation. People don't come when they first see it. They go to chemists, they go to the prayer houses, they get advice from their mothers-in-laws, the pastors, mommy GOs and all that. So we noticed a lot of women come late, so we went into the streets. And early in this tenure, we collaborated with the Office of Our Excellency. The Office of Our Excellency was able to mobilize. We had about over 8,500 women seated at one of the general hospitals at Ebonyi, Abakaliki. We taught these women extensively about themselves, focusing on their cervix and how to care for it. And then the ones that were willing, we screened over 300 women, and we were also able to see the ones that were diseased or had issues. We were able to refer them back to the teaching hospitals, and then the ones that require surgery or burning off were done. Now when it comes to people living with disability, we've done several works with them. We worked with the blind, we gathered every blind person in Ebonyi, we pulled them from the schools of the blind, we gathered them at the person's disability home at Presco where it is, and we screened their eyes. With the Office of Our Excellency, we were able to pick the children that their eyes were salvageable and surgeries were done for them. She empowered them. The people that couldn't move on their own, mobility was provided for them, motorized wheelchairs, people that needed hand canes and all that. And then also some funds to start up some businesses. They were trained to do some things. So work with, there's a school of the deaf at Sumofe. We went there and they told us that the problem is that when they come to hospital, the doctors are unable to communicate with them. So we gathered our female doctors. They trained us on how to do basic sign language. I learned good morning, good afternoon, I have fever, I have pain, my tummy is paining me and all that. We were able to learn. You know, we don't just go do one thing and come out. We noticed the gap. We were told about the girls getting pregnant, leaving school, a lot of that going on. So many of the girls didn't know how to manage their sexuality. So we came back, gathered the adolescent specialists, went back to them, gave them sanitary towels, taught them about their health, told them how their bodies were theirs, we taught them the pant rules, nobody should touch you anyhow. Because they find it difficult to communicate, but we were able to teach them a lot and we're getting positive feedbacks. That's for the people that are living with disability. We've also worked with the elderly. About 18 months ago, over 13,000 elders gathered at the Communica Center. We came in as the team of doctors. We did blood tests for them, we checked for hypertension, for diabetes. We have the ophthalmologists, the experts that were there screening their eyes. So they provided free medical care for all those elders. Many of them were retirees, many of them do not have access to healthcare, but we were able to provide this. Proper referrals were also made and continued management. We've worked with children too. You know, when children are growing, when they become teenagers and adolescents, it's a troublesome period for them. Not really troublesome. They are battling a lot. Their hormones, think they know things they actually do not know. They don't want adults to teach them what to do. So, but this is a point in their life where they need a lot of guidance. So we worked with the Medical Student Association. The gathered students were at ICC. Beautiful crowd, over 500 students, various schools. And you see the students, they were listening keenly. We brought experts, doctors, lawyers, motivational speakers. M1 was there. We talked to them. We tried to give them direction about their lives. We were told how to handle several aspects of their life. We did the first one, we did the second one. And the men, we've not left them out though.